Good afternoon, everyone. Thank you all for signing into our webinar today on cleaner energy strategies in hospitals. My name is Cornelia Buggy. I am Climate Policy and Membership Officer at Healthcare Without Harm Europe. That is the European arm of a global coalition working to transform the healthcare sector worldwide so that it becomes ecologically sustainable and a leading advocate for environmental health and justice. If you experience some trouble with the sound, you can fix the issue by clicking on the headphones icon above the chat box. So about the background of today's webinar, we all know that healthcare is among the most energy-intensive sectors. Many of our hospitals were built in times of low energy costs, and they are still powered by fossil-based energy sources. Their 24/7 operation period also means that they have a relatively high energy consumption and carbon footprint. In Europe, the some 15,000 hospitals emit approximately 250 million tons of CO2 per year, accounting for at least 5% of the EU carbon emissions. Healthcare facilities that reduce energy use also contribute to climate change mitigation with encouraging results, as we will see today. There are, however, significant barriers to investment in clean energy and efficiency in hospitals, including lack of awareness or competence or perceptions of technical risks, just to name a few. Today, we choose to address the first barrier. We are honored to have two amazing speakers with us today, Sonja Roschnik and Annegret Dickhoff, who will share best practices from two European countries on how the healthcare sector reduces its carbon footprint and saves energy. Well, Sonja Roschnik is the operational director of the NHS Sustainable Development Unit since 2008. She is leading the international efforts, strategy and program implementation on behalf of the SDU. She is also the director of the Humanitarian Center in Cambridge alongside her role at the unit. Sonja will talk about the efforts of the National Health Service to reduce its carbon footprint. Annegret Dickhoff is project manager at BUND Berlin, the Berlin branch of Friends of the Earth Germany, that is one of the most influential environmental organizations in Germany and also a member of Healthcare Without Harm Europe. Annegret is going to present climate and energy-related projects in German hospitals later on. Before we start, I would like to encourage you to please send your questions as they arise during the presentation, either through the Q&A box of the WebEx software, choosing all panelists from the drop-down menu, or via Twitter at Healthcare Without Harm Europe, and we will hold a brief Q&A session at the end of our webinar. If you have any troubles, my colleagues will try to help you solve it. And now I will give the floor to Sonja.
Thank you very much, Cornelia. I'm delighted to be part of this webinar, and I hope that you can all hear me well enough. If not, please somehow indicate to me that you need me to slow down or to speak clearly. So yes, I work for the English health system, and that's across NHS, which is a big nationally funded service, Public Health England, which covers all of the public health in England, and social care. So it's quite a large sector that we are trying to work with. And I guess just as a reminder, before I get started in telling you a little bit of our story, I guess I wanted to show you two slides that highlight why I feel it's so important for us to make very significant progress on this. And this first slide really will highlight how much we are contributing to the greenhouse gas issue around the world. It sizes each country according to the amounts that they contribute. But if you look at where the burden is felt, you can see that there is a huge inequality in the people who contribute and the people who feel the burden. So we really do have a very huge task and a very high need to tackle this. The next slide I'm going to show you highlights the carbon intensity of the NHS and the public health and social care system in England and the progress we've been making. So this looks like a really good graph. It looks like we're doing wonderful work, and that's because if you look at it per pound spent on healthcare, we are reducing things significantly, and we've still got a long, long way to go. I will show you a different graph of our carbon projections later, which is our absolute carbon emissions, which doesn't take into account the demand on our services. And in reality, that's the one that we need to take most consideration of. So the approach that we've taken in the UK has been really to consult with our service. We very much work on behalf of the health sector and for the health sector. So we're not a government agency. We need to work with all the people that are party to our services to see how they feel we need to tackle this agenda. We developed very early on a carbon reduction strategy, and I'll talk you through some of those things later. Some scenarios, we're looking at what it might look like in 2030. We recognize that developing some board leadership for hospitals was absolutely critical, as well as developing some tools that spoke the language of finance directors, which is the marginal abatement cost curve. We've used a number of other things to help push this agenda forward, and the route map for sustainable health was really to try and highlight all the different aspects that need to be pushed simultaneously to make any difference. Public opinion surveys help as well, because we found that a number of people were skeptical that the public wanted this to happen, but we have demonstrated that that's the case. Recently, we've built on the carbon reduction strategy and developed a sustainable development strategy. And I'll tell you a little bit more about those other aspects as we go along. So this is the Saving Carbon, Improving Health carbon reduction strategy, which has a lot of different elements to it. And the main graph that was included in it was this horrific graph, which highlights our absolute carbon emissions from 1990 going forward to 2020. Now, this was before the recession, and so our view of how the spend was going to go, was, I'll show you here, was that it was going to just keep going up and up. You will see in the yellow line, so that's here, this yellow line, that this is all of our Climate Change Act targets. In the UK, we've been lucky enough to have some legislation in place since 2008 that suggests that we need to reduce our carbon emissions by 80% by 2050 on a 1990 baseline. So that highlights to you how much work we've got to do to reduce it. So these are the areas that we decided we needed to look at in more detail to help reduce the carbon emissions of the NHS at the time. And we recognized very early on that we would need to go way beyond these things and start looking at what some of the potential scenarios for reduction were. So we came up with this graph which sort of highlighted how much contribution each element could make to the overall picture. And it was about refurbishing and replacing buildings, but also looking at reducing travel, making sure that there was more renewable electricity on the grid, reducing pharma, reducing procurement, and so on. And we would need to do all of these to make any significant progress. This graph highlights that, and this was really to have a mechanism of interacting with finance directors. It highlights how of interventions that reduce carbon, and most of these here on this graph are based around buildings, will save money and save carbon. So on the horizontal line going to the right, you have all the savings in carbon, and on the vertical line going downwards, you have the savings per ton of CO2. So it really highlights that a lot of these things, if you do them well, they have a short return on investment and can save money. So there's no real reason why we shouldn't do that. This is what we think are the possibility of the savings across the NHS. We know that we've saved already £10 million because of a near 2% reduction in energy consumption, and that if we implemented the marginal abatement cost curve, as I showed you earlier, that would be another 180 million. We know that simply improving some of our models of care to reduce variation and where we've calculated the carbon impact, that would be another 68 million. So, or if you adopt a more corporate approach where every organization has a sustainable development management plan, you can reduce that by at least 65 million. the big number here, which is in the purple, is the 17 billion, which is if we really tackled a reduced burden of disease by improving public health, we would save a lot more by reduced admissions for respiratory conditions or cardiovascular disease. So you can see that there are many, many reasons why we should be tackling this. When we looked at the carbon footprint of the NHS, we wanted to compare that not just to the energy in buildings, but how much it linked to the way we delivered care. And we calculated a very broad estimate for what one bed day might look like. We know how much money it saves, and we think it saves about 80 kilos of carbon per bed day. In the NHS, we calculated some time back that we have a lot of variation in the way we utilise our beds and how well we run our services. And just by doing that more efficiently, we could save quite a bit of money and a lot of carbon. So this isn't just about how we do things in our buildings, it's also about how we run our services. And the next slide will show you that it's also about the things we buy, and that this depends a little bit on how on the things that we buy, and this depends a little bit on which part of the sector you're in. So you can see here that most of this big green things are to do with energy in buildings in the acute sector. But if you look at this big one, it's to do with all the GP prescriptions in the community. We've also got a lot here in the acute sector around acute medical instruments. So each sector has got different areas that they really need to tackle, and we need to be looking at all those hotspots all together. So to highlight some of the progress we've made, I'm showing you a second carbon graph, and there will be a third one later on. And this highlights really how we've been trying to get a lot closer to this target here that we set ourselves for 2015. That's rounding up next year, and we realise we've still got a way to go. But you can see that with the shift, partly to do with the recession, but also to do with the efforts that we've put into reducing carbon, we are beginning to make an impact on this carbon reduction. And, you know, we can't be complacent because there is so much more that we need to do. Thank you. I've just realised that you're asking me to speak closer to the microphone. Maybe I can try and speak louder too. I hope that's better now. So in this next slide, I've spoken to you about this before. You see that actually in the UK, 89% of people through a public opinion survey really think that it's important for the health system to be sustainable. And if you think about it, it's quite logical. You know, this is in the UK, it's taxpayers' money, and you know, it is important that we use that wisely. And I think most people would recognise that using that wisely means making sure that we look after our resources and our environmental resources too. So that covers the carbon reduction strategy. We launched in this January of 2014 the Sustainable Development Strategy, which goes much further than just reducing carbon. And I think the beauty in this is how much it contributes to a wider system thinking, how it can make all our services more resilient and our communities better, as well as reducing environmental impact. In order to do so, you really need support across the system. So we had sign up from the regulators, from all the royal colleges, from the providers of services in the community, from the information centres, from government, from all the different parts of the system. And I think it's really important to recognise that it's quite difficult to do on your own. So the model we've been working on is this sustainable health and care system, where we want to recognise that there is a lot that we can do to enable the positives, to improve the natural environment, to make sure that we've got more green spaces. It can help when we're adapting to climate change, for instance, that there is a lot that we can do in valuing all the social assets that are available in our communities. And there's a lot we can do to support people to be independent and well in their own homes and to lead active lifestyles so that they are healthier generally. We also need to obviously work on making sure that we reduce our environmental impacts. That's carbon, but it might also be some other polluting factors, and also how much water we utilize. We need to reduce inequalities, because clearly we know now that the more inequalities we have in society, the harder it is to have a healthy and just society. And clearly, we would want to reduce the burden of disease because otherwise we're just creating more work for ourselves. And in reality, this is where the beauty of trying to do sustainable development is for the health sector, is that if we do it well, we can achieve a lot more with a lot less. And that is surely something to be celebrated. So the vision really is quite simple, and it's that we should protect and improve health within the resources that are available to us, and not just do it for now or the next day, but do it way into the future. There are 3 goals. One is around a healthier environment, that has got something to do with making sure that we reduce our carbon footprint even further. So this is now a 3rd graph that I'm showing you, and this is the carbon footprint not just of the NHS but also of the social care sector. And you can see that if the numbers are higher, that we're also making greater reductions. And we've still got a long way to go if you think of this as being the targets that we need to be trying to achieve. So although we're making progress, we've got to keep working at this significantly. The other thing that we've tried to do to reduce the carbon footprint is to highlight the big area that is contained within pharmaceuticals. And we developed some guidance to support the measurement and monitoring of pharmaceutical products and medical devices in relation to carbon. And that's available on our website if you're interested to find out more. But clearly, we highlighted this as a big area and needed to develop some methodology to deal with that. The second goal is really that communities and services are resilient to changing times and climate, and that is really important because there is a lot that we can do to mitigate climate change that will also support resilient communities, and that will also help us to adapt and to be more supportive of vulnerable people in due course. And the last principle really is that there is, for every one of us in the healthcare sector, wherever we're positioned, whatever we do, we can contribute to the decision-making around improving health, lives, communities and environments. And that is in the way we buy things, in the way we use things, in the way we throw things away, in every decision we make. And we're trying to make that principle core to everything we do with everyone. Now, in the UK, we are also looking at how we can make the health sector financially sustainable. And there is a lot of discussion around what the model of care might look like in order to do that. And we really think that the majority of our efforts should concentrate on living well with very little concentrated on hospital care. And we should really be trying to avoid anybody going into hospital or to support them to manage their condition outside of the hospital setting. And this means that the distribution of effort would look quite different. And I can talk to you more about that if you're interested separately or at another time. I think I'm going to be running out of time. So what we're doing now is we're really looking to consider adaptation to climate change across the entire health and care system, and we need to report on that early next year. We want to have achieved our carbon reduction of 10% by 2015, and although we haven't got there yet, we're quietly confident that we'll have just about achieved it, but that is only a very small success, because if we want to get to 80%, there's a long way to go. We have got our system signed up to a UN statement to say that we are all wanting to work on this together, and just reiterating that wish and that will is very important. And we've now got a cross-system group that helps us to monitor that. So they're very an important conduit for us to highlight issues or barriers or opportunities. And now we've got this Coalition for Sustainable Pharmaceuticals that is going to take the carbon footprinting to a different level. We want to look at footprinting our care pathways in a different way. So the result that we hope to achieve, and that we've already started to demonstrate, is that we will have reduced environmental impact, and we'll have it in the absolute. So that means that we will have reduced our impact despite the fact that our demand for services has increased by at least 13%. That we'll have prepared communities, good leadership at community level, that sustainability decisions will be embedded, in everything we do. And of course, this must contribute to improved health outcomes and the ability to demonstrate good practice, recognize it, and replicate it. So I was going to leave it there. I've just noticed that there is a question. So the response from suppliers has been, we've asked them to identify the carbon footprint to carry out a carbon footprint within their organization and to start reducing the hotspots. So I think they recognize that this is an important agenda. We didn't go to them and say straight away, we want you to reduce it by 10% or we want you to do this. We went to them and said, we have got a problem. How will we manage this together? What do we need to do in order to make it better? And that's how we approach the pharmaceutical industry. And I think they appreciated the fact that we saw this as a shared problem, not as their problem. And, that's where some of this good work has come. There is still a lot of unknowns and things that we need to research further so that we make sure that we do find the right answers. So I think engaging in a conversation with suppliers helps the discussion rather than just say, you must do it like this. I hope that's answered that question. And I'm happy to answer any other ones or to hand over to you, Cornelia.
Thank you very much, Tanya, for your presentation. If you have any more questions, please send those to the Q&A function of WebEx or contact us via Twitter at HCWH Europe. Well, now I am going to turn the floor to Annegret Dickhoff, who is going to present us the German example. Annegret, you have the floor.
Yeah. Thank you very much, Cornelia. Thank you for the introduction and the invitation to the webinar. And I'm going to present two projects to you about climate protection in German hospitals. I hope I'm loud enough to you. I can hear you very well. So, first, just a few words to the organization I work for. As Cornelia already mentioned, I'm working for the BUND, which is the German branch of Friends of the Earth. In German, you would say Bund für Umwelt und Naturschutz Deutschland. And it is a non-governmental organization and was founded in 1974, originating from the environmental movement. Today, it is one of the most influential environmental organizations with about 500,000 members and supporters in Germany. The regional association in Berlin has its main focus on city-related topics, but we also run two nationwide projects. The first one is the BUND label Energy Saving Hospitals. And since this year, we have a new project. It's called KLIK, Climate Managers for Hospitals. And I will introduce you to both of them now. On this slide, you can see a little bit, on this slide, you can see a little bit similar to what Sonja said before, the development of greenhouse gas emissions in Germany. So it's the German way. And it's since 1990, so you can see it on the green bars. And the goals set by the German government for the year 2020 and 2050 with the red bars. Germany wants to reduce the CO2 emissions by 40% until 2020, but recently they calculated that there's a gap of 7% in the next 6 or nearly 5 years to close this gap. Because the time frame for action is getting smaller, the government started different activities, and the government is planning a new law to demand more effort from the big energy companies, for example. And also, they started different support programs, and one is called Deutsche Klimaschutzinitiative, or in English, German Climate Protection initiative. And by the way, this initiative provides money for our second project, for the KLIK project. I will tell you later. Before I speak about these two projects, I would like to give you a quick overview of the status quo for Germany. So in Germany, we have more than 3,000 hospitals with about 670 beds. And the energy consumption per bed, which you can see at the bottom of the slide, equals an average energy consumption of 3 to 4 one-family houses here in Germany. And that is compared for just one hospital bed. Regarding the costs on this slide, more than 60% of the costs are needed for the salaries of the staff, so the personnel costs, and around a little bit more than 30% is for non-personnel costs, so for procurement and everything else. And from that, energy costs represent 1.7 billion euro in total. This translates to about 2,500 euro per bed per year in terms of energy costs. And if you just look at acute hospitals, so without rehabilitation clinics, costs are even higher, so around 3,300 euro per bed per year. The Friends of the Earth Energy Research Group identified an energy saving potential of hospitals, and this is 600 million euro, and accordingly 6 million tons carbon dioxide in total. And we know from our work with hospitals there's a potential of 10 to 50% energy savings per clinic, and we think that's a high potential, and we should work on that. So on this slide, you will see some motivation and aim for our projects. To save this amount of money and to save energy, the hospitals can act in different ways. We already know they can invest money for new facilities, or they optimize their running facilities. And the aim of both of our projects is to get the hospitals started in energy-saving actions, or to protect or to support them in their way how they save energy. And our political goal is that energy efficiency becomes a quality feature. Here you can see some pictures of the BUND label project, Energy Saving Hospital. In order to do that, we search for good practice examples and grant the label Energy Saving Hospital, which we are going to establish as an accepted standard in Germany. And this label project was started already in 2001, so a long time ago, you would think. And until today, we have 43 hospitals have received the label. So on these photos, you can see it's, I think, a very nice photo on the right side. You can see what it looks like when the staff and the CEO of a hospital receives our BUND label in a ceremony. Because the people are very proud of what they have done, and that they achieved or received this label. It was hard work normally for them. Because on this slide you can see the criteria for the project or for the label. You get an overview of the criteria, what a hospital has to fulfill. The hospital has to reduce the energy consumptions in the last 5 years, and they need to have an energy management. I will show you a little bit more in the next slides. And the label is valid for 5 years, and then the hospital has to be re-examined again. So if you are one time an energy-saving hospital, you are not for the next 20 years an energy-saving hospital. What can the hospitals do for the climate protection? There are 3 main fields, like heating, electricity, and energy management. And first, we have to look at the heating, for example. So normally, heating needs 70 to 80% of the whole energy consumption in a hospital. And insulation is very effective for hospitals and also for other buildings, but often it's a long-term investment. Often the hospitals have to start with new heating facilities because their old facilities need an upgrade. And one option is, for example, to install a combined heat and power plant. That's very common in Germany and also very common in the hospitals who have received the label. But also solar thermal power plants make sense in hospitals. So 4 hospitals with the BUND label use this kind of solar power plants. They produce hot water and support the heating system, so they don't have to heat up too much cold water. But hospitals still always need other energy sources. But hospitals still always need other energy sources beyond that technique. Okay. And another point is that measures for climate protection is electricity. 20% of the energy consumption is for electric energy. And in Germany, electricity is expensive and it has a high carbon dioxide footprint, as you know. So, for example, 30% of the electricity consumption is needed for pumping hot water through hospital buildings, and around 40% is needed to run the ventilation. So it makes sense to control the efficiency of the pumps or the ventilation, or to replace them by newer ones, or to do by newer ones. And here you can see some photos from hospitals with a label that use renewable energy, so solar panels on their roof or on their frontage, the balconies, in all different ways. Or they use the normal daylight, for example. All hospitals have to have an energy management to receive our BUND label, and that means they have to do the loop of planning, doing checking and acting again, and they have to have somebody who is responsible, so who is the manager, the energy manager, if you want to say so. And for sure, it's always interesting to include the staff and train the staff how to behave with the energy. And the effects of the energy-saving hospitals, all in all, the 43 hospitals already saved more than 68,000 tons carbon dioxide per year because of the activities, and to reduce their energy consumption, and that means that's 22,000 megawatt hours electricity and more than 140,000 megawatt hour heating per year. And you can imagine how much square meters of households you could warm up with this amount of energy. And for sure, for hospitals, it's always important to save money. And for the budget, every hospital who is active in energy consumption reduction, they can save more than 100,000 euro per year. And we have one big hospital, they saved 2.1 million euro per year because they invested or did something about their plans. So all in all, more than 20 million euro per year were saved in all hospitals. we gave the label to. But now I would like to tell you a little bit more about our new project, because we see that we have good results and we would like to continue to motivate more hospitals. And the second project is to motivate more hospitals for reducing energy consumption. And it's called KLIK, as I said already, and it's a focus on low and no cost measures for energy saving. And the goals here are that we want to make it very interesting for a lot of clinics. We want to qualify 50 climate managers, so we call the people who are active in a hospital the climate manager. And so we want to involve 50 clinics or 50 hospitals, and we want to help them to create an internal network, so the climate manager is not only working and active on his own. And we want to prepare an online guidebook in this project, and that will be published towards the end of the project. We also have an online database that is running since this month, and the overall aim of KLIK is the reduction of at least 30,000 tons carbon dioxide, and this translates to about 10% per clinic, and usually means a reduction of energy costs about we expect 6 to 10% per hospital. So on the next slide, you see a little bit the course of the project. I don't want to tell you too much about it, but perhaps a little bit, yeah, you can see that we are doing training with the climate managers, and we are doing workshops, and we have this database where everybody, not only the 50 hospitals, can see the best practice examples of German hospitals and find some measures what everybody in every hospital can work out. So the criteria of the climate manager is perhaps interesting, because it could be a person working in administration, but it also could be a person in technical or quality management. So it is not so important in which field the person is working. It is beneficial if this person has an affinity to climate protection issues and the authority to decide, or has a certain degree of influence in decision-making processes. Because we need somebody who is active and who has an important role in the hospital to get other people to move on too. What have hospitals to do during the course of the project? The first step is they have to find a climate manager. So they have to have somebody who says, okay, I'm interested in that project and I will do, or I want to be a climate manager in my hospital. And then the hospital has to get him or her qualified in our seminar. And then the climate manager creates a network of supportive colleagues in his hospital, and he gets an overview regarding energy consumption, so that we have a baseline for the energy consumption to calculate later how much the hospital saved. And the climate manager collects ideas for non or low cost measures to reduce the energy consumption, and they create an action plan for the implementation. So all climate managers present the current status in our workshops, so we can see if we can help them or if the people can help each other, so the climate managers can help each other. On this nearly last slide, you can see that there are already some hospitals interested to participate in the project. And we are very happy about so many interested hospitals. So until today, we already accepted 33 hospitals as project partners, but we are still recruiting more here in Germany. So we already know that the next trainings will be in March and April 2015. And after that training, we have all the climate managers together, and then they can start to implement their measures. So you got a little overview about our two projects, and I'm happy that you listened to me, and feel free to ask me even if I ignored, or I'm sorry I didn't see the questions before I already got. Thank you for Cornelia to answer it for me. Thanks.
Thank you very much, Annegret, for your great presentation. Before we go ahead with the Q&A, I would like to let you know that Healthcare Without Harm Europe has been working on this issue, namely climate and energy-related issues, for the past few years. If you want to find out more about the issue or work, if you want to browse through some additional resources and case studies from our members, you can visit our website, that is noharm-europe.org. Also, Healthcare Without Harm created the Global Green and Healthy Hospitals Network, that is a worldwide community of hospitals, health systems, and health organizations that are dedicated to reducing the ecological footprint of their facilities. The membership of the network is free, and it offers a variety of benefits, including a social media platform called GGHH Connect and several guidance documents and expert advice on the 10 sustainability goals, including green buildings and energy. GGHH has recently launched a brand new guidance document on energy, as you can see it on the right side of the slide, for its members, and it helps hospital staff make the necessary changes to reduce their energy consumption and energy-related fossil fuel emissions by identifying specific actions that healthcare facilities could take. The full document is only available for the members of the network, but you can browse through a number of energy-related success stories for inspiration on their website, that is greenhospitals.net. Well, if you are looking for further inspiration from Europe, there are a couple of ongoing and already completed European projects that could provide a huge amount of information, including evidence and guidance on this subject. Links to the websites of those projects will be circulated later. Well, then let's go ahead with our Q&A session. We have received several questions through the Q&A function. One is here for Sonia. From Christina. Do you know if there are any measures put in place to reduce waste and anesthetic gases from operating theaters?
I think there are some people who are starting to look at it. We know that for most acute hospitals, it's about 5% of the entire footprint. And I know that in the United States, they're using some reprocessing of anesthetic gases as a way of dealing with it. So we're only just beginning to identify it and to start looking at solutions. So if you've got any ideas, we'd love to hear from you.
Okay, thank you very much. Also, Annegret has received another question. Where is the biggest potential for energy savings, in the buildings or in energy used by the healthcare, for example, medical equipment? Well, actually, you might have already answered this question during your presentation. Can you please confirm that it's heating?
Yeah, it's heating for sure. It's the easiest way actually to reduce the energy consumption, but we don't focus on procurement, for example, and I'm pretty sure that if you look at the products, you can also reduce a lot of energy. But in the building, it's for sure it's the easiest way to reduce the heating consumption. Yes.
I see. Thank you very much, Annegret. I have another question for Sonia. Could you please tell us more about the recent cross-system statement for the UN Climate Summit?
Yes, so with the UN Climate Summit that was happening in September in New York, we felt it was a good opportunity to ask all our organizations to sign up to a common statement. And we felt it was a good way of making sure that our system was serious and in demonstrating so internationally that we wanted to make progress. And it's given us the opportunity now to say that by having written a statement, we will measure and monitor it on a yearly basis so we can hold ourselves to account. Now, in that statement, it says a lot of things that are in the carbon, in the Sustainable Development Strategy, including that we will reduce our carbon emissions across Scope 1, 2, and 3 by 34% by 2020, that we will try and increase the resilience within communities. A number of the things I listed on my last slide as success criteria, we have put those into our statement. I think it's a useful mechanism to draw organizations together to have a common aim and a common vision, and that's what we used it for. We've got a small video as well from one of our chief executives who is speaking on behalf of the other chief execs to highlight how strong the commitment is.
Thank you very much. And we have received another question for both of our speakers, I guess. How are these energy savings measures financed? Are there any utility incentives?
So who starts? Sonia?
Would you go, Annegret?
Okay, normally in Germany it's like that the hospital has to invest, or they find partners. So big companies like Siemens, for example, they give money and they have a contract. They have a contract together, so that the big energy company gives the money, and they get money back from the cost the hospital reduced when they have newer facilities, for example. And some hospitals get money from the government, so from the state government, but they don't get it every year, and we have a big problem that there's not enough money for the hospitals coming from the government. And so they have to find a solution financed by the hospitals itself, or themselves.
And I guess in the UK, we've everybody is tight for money. I think there are some mechanisms where the return on investment is quite short, and hospitals can either put up the money themselves or enter into a contract with a utility company, for instance, so that or a company that will help them reduce their energy levels, and they will share the profit from that. So the company puts the money up front, and then they both share in the return on that. But I would just like to say that, done well, this can save an awful lot of money for the health sector. And I actually think that hospitals that are quite savvy can try and even just start reducing the energy consumption through behavior and use those savings to reinvest. So there are some clever things that can be done. But and there's some clever contracts with private companies who will put the money up front and then share out the savings as they come through over time. And can I just add another point about there is a question about the energy savings and buildings or medical devices, and I think it does depend on the age of the building. Certainly in the UK, we've got some where the percentage is more towards building, because they're older buildings, but in newer buildings where the majority is more in the use with medical devices. So I think it does depend on the type of building and the equipment being used. But in the big, it is still according to our data, that's still only 22% of the overall carbon emissions. And 25% is in the pharmaceuticals and medical devices. So it's just worth bearing in mind that there is a lot of different aspects to consider here.
I see. Thank you very much. We have received 2 other questions. The first one is, where do you think that one can start saving energy in hospitals in countries that are located on islands in the Caribbean? And secondly, can we in the Caribbean collaborate with your organizations in Europe?
So shall I start? I think, of course. I mean, and I'm sure that through the green.
Okay.
Sorry. Please don't. Shall I keep going, or?
Yes.
Yeah, keep going. Keep going.
Sorry, I think, of course, I think that the GGHH mechanism is a really good one for sharing and collaborating. And certainly our website will have a lot of details as to who to get in touch with at our end if you want to find out from anything from the UK system. I mean, I think that there are lots in everything that we do, from switching off lights to computers to making sure that we've got the right kind of mechanisms in our buildings. There, at every level, there is energy that can be saved, whatever your setting is. And I think the other element is in renewable energy, and I'm sure in the Caribbean you have got opportunities for that, which may be very have more return than we have in the rainy parts of the UK, for instance.
Thank you. Annegret, do you have any remarks?
Yeah, I guess it's a little bit difficult to work with, especially with me now here in Berlin, but for sure, Friends of the Earth, you can work with us, and you can perhaps you can get some more ideas if you go on our website. Even if we just started to give some examples in English, and we still work on it, and just feel free and try and send an email, and perhaps I can answer some of your questions and give some support.
Thank you very much. You may also get in touch with us. There is the last question. Have you faced any concerns about disrupting the normal course of operations in hospitals? For instance, are critical care areas out of bounds?
I'm sorry, I didn't understand this question.
So have you faced any concerns about disrupting the normal course of operations in hospitals? For example, in critical care areas?
I guess I can't answer that. I'm sorry about it.
So
Sonia?
I think, in the UK, I think that this sits, clearly we need to make sure that there is always the energy supply that's required for critical care operations. And in the hospitals in the UK, there is always a backup mechanism in place. And I think it's absolutely key that if we embark on this kind of journey, we make sure that there is going to always be energy for those things. I think that by doing it well and putting possibly renewable energy systems in place, we can improve the resilience of hospitals so that they have less need for their backup generators. So I think actually we should see it as a way of enhancing the independence and resilience of a hospital and a structure, rather than necessarily something that's going to hinder operations. And it's in terms of trying to reduce carbon more generally, trying to ensure that hospitals are as efficient as possible in what they deliver. Everything helps. So be that reducing travel, be that making better use of staff, be it using accommodation in multiple ways. There are so many different things that can be done that will also help. And that's why our strategy is trying to build resilience and reduce carbon. I think you can do both at the same time.
And I agree. So for sure, safety questions are very important in Germany, and so that is the reason why we say that the hospitals can reduce the energy consumption and not only use, perhaps, for example, renewable energy. So they have to double check everything, and but anyway, you can do so, and you can use renewable energy sources, and also you can run your hospital in a safe way.
Thank you very much for your answers. Before I give the floor to one of our attendees who would like to share best practice from Sweden, there is a last question for you, Annegret, from Raymond. Can I visit you in Berlin as I live in Germany and even join your KLIK Clinic Energy Manager program?
For sure you can, and I would love to meet you on the 19th of March in 2015 when we have our big German hospital conference for for people, for experts, and there you can see, you can hear and listen to some speeches and presentations about the labeled hospitals. For sure, you can come.
Thank you very much. And now I'm giving the floor to Eva Hallström from Sweden, who is going to share her experience with us. Eva, you have the floor.
Thank you very much. We would like to share our good example here from Värmland in Sweden. We have reduced our greenhouse gases with 50%. It's already done, and we are reducing it now more of that. We have 100% renewable energy, and we have also are the most energy efficient hospital in whole Sweden. So we are using less energy per square meter in whole Sweden. We'd like to show how we have done this. And here in this room, we have also Lars Nilsson, who has worked very hard on this, and also Kurt Moonfeld. I would like to give the floor to Lars, who has been talking to this, and we have also reduced our chemical emissions as well. Please, Lars, say something about the work that you have done for some years.
Yes, we have reduced. Perhaps we could show you a little bit more in Berlin in March. I think we need some more time to prepare this.
And because we are a good example of reducing our energy, because we have connected heat with cooling system, and we use also our river to cool and heat our hospitals as well. And then the greenhouse emission is reduced for in about, what do you say, 9 years with over 50%, and it's already done. So we have already done this reduction, and we like to share with other countries our examples and try to get more reduction at home. Thank you.
Thank you very much, Eva. It looks like you've done a marvelous job. Well, since we are reaching 5:30 soon, I would like to thank for all of our speakers and all of you for joining us today. Shortly, we will circulate an email containing the links to all of the materials mentioned and the recording of today's event. I wish you all a nice week, happy holidays, and a successful new year, and hope to see you at some of our other webinars. Thank you very much. Goodbye.